Welcome to the Ripple of Change podcast, searching for our quadruple aim, where we highlight, celebrate, and extol others doing amazing things in healthcare and beyond. I'm your host, Dr. Otten, and the topic today is primary care for all Americans. I am thrilled to be joined by two colleagues, both physicians, family physicians, Fatima Khan, who is only got 13 days left in her first year of residency, I was informed, not that anyone's counting, at the Jamaica Hospital Medical Center, which is a very diverse place from what I've been told. So I'm excited to hear more about that. And our guest today, prolific author, and I now consider a friend, Michael Fine. In fact, I had to grab a copy of his book right here. For those of you on YouTube, you'll be able to see it. Healthcare Revolt. This was great. I loved it. Raw, just peels back so many layers. Fantastic. If you get the opportunity, I highly recommend it. But he is also the president and board chair of Primary Care for All Americans. So, Michael, I'd like to start with a question to you, if I may. Tell me the why behind Primary Care for All Americans.
I think many of us have watched over the years primary care kind of get taken apart. And it's been a very painful thing to see, given that there's a mountain of evidence showing that countries, that healthcare systems that focus on primary care are the healthcare systems that have the best outcomes at the lowest cost. I mean, it's not a little evidence, it's a mountain of evidence. And it's been very hard to watch that we seem to be going in the wrong direction as a nation. And the only reason that I've been able to think of over the years that we're doing that is that people who are profiting from the market that we have are using their, what I sometimes call ill-gotten gains, to mess with the democratic system and get the outcomes they want instead of the outcomes we want. And, at the same time, if you look back on American history, it's really an interesting history because we are a nation that put together an interesting and, very exciting democratic process, but it doesn't do social change very well. So what's happened in our history is, if you really look at what Congress does and what state legislators do, they usually, have a lot of meetings and study commissions and don't get much done. And often that's a good thing. That's not criticism. It's a good thing because it keeps us from going in the wrong direction. But when we get a social problem that's intractable, that the political process can't solve, as we have many times in our history, we end up having to put up a social movement to make the kind of progress we need to make. So the abolitionist movement, the movement for women's suffrage, the labor union movement, the anti-war movement, the civil rights movement, the movement for marriage equality, they were all social movements that ended up creating the kind of social improvement we needed because the system locked up. And, when you think about it that way, the system has locked up around healthcare, even though we know the right answer. And so the answer became, if the system is locked up around healthcare and the political process ain't getting us there, then we darn well better build a social movement and make it happen that way. Now, building a social movement is a crazy, scary, insane thing to do. I mean, who would want to do that? It takes years and years and millions of people. And yet the alternative is, continuing to go down this road of hugely expensive healthcare, poor outcomes, and the erosion of democracy in the process. So that's why we're doing what we're doing. It's to build that social movement, create a healthcare system that's for people, not for profit, and starts by providing primary care to everyone in every American neighborhood and community.
Yeah, adding on to what you said, of course, like all great points, and especially the thing about social movements. So one of the ways that social movement could really be conducive to primary care for all Americans that we have been discussing is make sure that all Americans have access to primary health care and equitable access. And second would be to inspire and support members of states, different communities, every little town, the students who want to grow up and perhaps become nurses, physicians, physician assistants. And once they are supported, they become the primary health care providers for their communities. And that is perhaps like the end goal or the bigger picture, so that every community, every town, every state is well supported. And that reminds me of one of the things that recently happened in our hospital, at Jamaica Hospital, where I'm an intern currently. Queens is the most diverse borough. And recently we had a patient come in. She came into the ER and she spoke a dialect which was very rare, or as far as that is what was told to us by some of the people who brought her in. The beauty is of investing in communities that we had not one, but two speakers amongst our staff, two nurses who spoke exactly that dialect as native speakers. And we did not have any trouble communicating with her. She felt seen, she felt heard, her concerns were validated. And I think that's one of the beauties of investing in communities at every level.
That is beautiful. That's just music to my ears. And honestly, that's going to lead right to better outcomes, better experience. It's a better experience for the clinicians and ultimately lower costs, which is our quadruple aim encapsulated. As I said, I always screw up something in the intro, and I realized that I just screwed up today, even though it wasn't that big of a screw up, but I want to get it in here because I wanted to add a component of gamification going forward. And this is the first episode where I'm going to do that. So usually we have Ripple challenge questions, which I'm going to do one of those later, but I wanted to have a Ripple challenge word of the day. I guess I'm going to have to come up with something better than that. But the idea is at some point in the show, I'm going to use a word that I don't always use so that the casual listener can be trying to clue in onto that. So stay tuned. I'll probably jump up and dance or something when I do that. But it'll be coming at some point. So Fatima, I'd like to throw it back to you for maybe the next question.
Okay, so one of the questions that I would like to pose is, what was your light bulb or aha moment when you realized either this is what you want to see happening, or this is something that you need to start changing?
Is that for me?
Anyone.
Well, it could be for either one of us. But Michael, you're the guest, so everyone's heard me drone on multiple times. We want to hear from you.
All right. So it was actually a phone call from Alan Roth, your chair, the light bulb moment, the chair of the Department of Family Medicine at Jamaica Hospital Medical Center in Queens, New York, who's an old friend. And Alan called me kind of in despair one day. Now, honestly, I had sort of given up. I mean, I was thinking primary care is dead. I did whatever I could. It wasn't enough. I'm going to go write novels, which is kind of what I've been doing. But Alan called me to tell me, sort of with a certain kind of heartbreak, that one of his faculty people at Jamaica Hospital Center. This was somebody who he had mentored from elementary school, whose mom was a ward secretary at the hospital. And he had heard about when she was young, he had sort of gently made some suggestions or hinted or helped as she went into high school, and did a little more mentoring as she went into college, and then did a little more mentoring and supporting as she went to medical school and made sure she got to medical school, and did a little more mentoring as she went through residency. I don't think she did residency at Jamaica, but he made sure that she got a good residency and got good training in family medicine. And then he made sure that she was one of his faculty people. And she walked in one day, I guess now about a year and a half ago, and said, Dr. Roth, I love you. I love what Jamaica does. I love the community. I'm from the community, but I can't take it anymore. It's gotten too crazy. I'm going to go do concierge medicine. And he was heartbroken because she was, in his view, the future. And because I've done a lot of health policy in my life, I kind of understand what the forces are that have been destroy primary care. And I knew, because I wrote that book, Healthcare Revolt, that the only way to approach this was to build a build a social movement. And so I said, Alan, the only way to do this is to fix this is to build a social movement. And I don't want to do that. And neither do you. And he said, I don't know. I don't see how we're going to continue without that. So I said, I guess. And that's when we started. It's like at the end of the day, I couldn't just walk away. And both of my children who are now in their 30s, are doing some thinking about leaving other things and coming to do medicine. And, so I also was thinking about them because that was just getting started. And I thought, it's just the wrong thing to do to take this mess and pass it to Fatima's generation. It's our obligation to pay it forward and fix it before we, sort of fade into the limelight.
Get ready for it. Here's the word. I'm going to get it out right now. Stupendous. Stupendous is the word. Well, and I think this is beautiful, right? Because we've got, Michael, it speaks to connecting those generations, right? I believe, Fatima, I don't know your age, but I'm guessing that you, Michael, and I are all of different generations, and having a beautiful discussion about this social movement to improve the landscape, primarily in primary care, which is an amazing thing and so desperately needed. So again, for those listening, word of the day was stupendous. I'll figure this framework out a little bit better as we go forward. I've got to ask, one of the questions that Fatima had written down, and I don't want to steal the thunder, but if primary care for all Americans had a mascot, who or what would it be? And I actually would like to hear from maybe both of you on this. I think it would be cool to hear from both of you.
Oh, can I ask Fatima to go first? I want to hear what she says.
I don't know. I feel like the thing that always comes to me when I have thought about primary healthcare, or when I made my decision of coming in family medicine residency, it's like two hands and there's a heart. So the hands are like protecting the heart or hugging the heart. That's like my picture, because it's like, we're going to protect you. We're here, we're together. We're going to make you feel warm and comfortable, and you can be vulnerable here. This is the safe space.
And I guess for me, and I'll go to mascots, I have two. One is an elephant and the other is an oak tree. The elephant, because it's big, it's solid. Elephants are very social animals and take care of each other. They really take care of each other. And elephants never forget. And oak trees, because they are also big and they are connected to each other under the soil. I spend a lot of time outside and sort of know that. But, big oaks are big, like they're amazingly big. And that's kind of what primary care needs to be, just amazingly big and shading everyone.
This is awesome. This is why I like to do this show. I get to learn. I get to talk to my colleagues. I get to smile. I get to laugh. Those are beautiful answers. I loved both of them. Fatima, I'll stop interrupting. Please go on to another question you might have.
One of the other questions that I had was, if you could change one thing overnight, like this is the change you want to see first and foremost, what would you pick that to be?
Oh man, that's a very difficult question to answer, because we sort of have to change 10 things at once. And so it's going to be I might go to two things. The first thing would be a committee in every neighborhood and community that's working on how to provide primary care to everyone, so that it starts in neighborhoods and communities, providing primary care for themselves. Something like a school board, or like a volunteer fire department, or a volunteer, you're in the city, Fatima, so you don't see these as much, but, volunteer fire departments which do EMS in many rural places. Those are the kinds of people taking care of each other that I think primary care needs to be. One thing that's invisible in most of America, and certainly even in rural America, is that cities and towns provide their own safe and clean water through these little water and sewage systems that are independent, but they're set up as private nonprofits, but they're community owned, and they've been running for 75 years providing safe water and actually in many places sewage stuff for everybody. Same thing, is the way it works with garbage pickup. We do lots of things and take care of things for ourselves in communities, and I would love to see us doing that for primary care. So that's one thing. And the second thing I would do is tomorrow quadruple the number of people in medical school and quadruple the number of residencies so that we're quadrupling the number of primary care folks we train. It is we are in a critical shortage. It is way bigger than what anybody understands. And unless we really make a big noise, it isn't going to get moved. We train about 22,000 medical students a year in the United States. About 65 or 66,000 people apply. And let me tell you, if you've survived organic chemistry enough to apply, my guess is that of the 65 or 66,000, probably 60,000 would make great clinicians. And I don't see why we're not training them all tomorrow. The other thing is, almost nobody knows that 25% of all physicians practicing in the United States went to medical school in another country. And what that means to me right off the block is that we're training 25% fewer clinicians that we need today, for the kind of lousy mess we have. And we just need so many more that we got to jump in and really start working on that big time.
Absolutely. And adding to that point of where you said, every community has a board that works or a committee that works to provide primary healthcare access. In my mind, that reminds me of a very small micro example. I would say it's like having that homeroom teacher. So you have these teachers who are taking care of all your other subjects and they're training you in arts or public speaking or different other things. But you always have that homeroom teacher you can come back to, who's watching your progress very closely and keeping an eye out for any pitfalls and is always advocating for you. So, you have that one person in your corner. So I feel that having a primary healthcare provider would also be like that person in your corner who takes care of your health and who watches out for if something begins to change, which shouldn't.
Absolutely. But that homeroom teacher works for a school committee or a school board.
Yeah.
There's somebody in every community making sure there are homeroom teachers.
Exactly.
And what we have at the moment, not enough homeroom teachers by far. And we don't have any communities that are making sure there are homeroom teachers for everyone. And so that's where we need the school committees and the school boards of primary care, essentially, watching out to make sure that homeroom teacher can be there, get paid, is supported and given the resources that person needs to do the job that needs to be done. And that's the other piece of what we're lacking, is that kind of community level infrastructure and support of primary care. So the primary care is supported not by health insurance companies or not even by the federal government, by communities themselves.
What I heard there, Michael, is you think insurance companies aren't getting the job done as it stands. Did I get that right?
You think?
I'm sorry, I couldn't resist. No, this is fascinating, and I see opportunities, as Michael and I have talked about, connectivity with some of the other groups that are out there, whether it's Doctors for America, who's doing a lot of advocacy work, whether it's Medicine Forward, who's connected with the Healthcare Reinvention Collaborative, working towards impact networks. I think that's where a lot of these entities that are doing good work can start to work together to really facilitate some dramatic systemic change. This has been fantastic. I love these kind of discussions. I love what I'm hearing from the both of you, but let's mix it up a little bit. Let's do a Ripple challenge question. And again, there's no rules to this, and so you can answer it however you like. I was thinking about what might be good earlier today, and my mind kept going back to dessert for some reason. I don't know if that's because it's Father's Day and maybe I'm hopeful that one of these things is going to come to fruition. But let's go with, what is your favorite dessert?
Ice cream sandwiches.
Oh, there you go. Any particular reason behind that, or?
It tastes good.
That's a good reason.
my kids, even after all this time, every year for Father's Day and for my birthday, they make sure I get an ice cream sandwich.
That is awesome. You know what I'm finding with these questions? There's these interesting connections that happen that I wasn't even planning for, right? Like today's Father's Day, and what a great story that your kids do that for you, Michael. That's beautiful.
I've had my ice cream sandwich already today. But how about desserts for Todd and Fatima?
So for me, cooking and like desserts, everything, baking, that is a passion for me. And you mentioned ice cream. With time, and I'm not that old, but still, like as I grew up and got more into organic food and fresh cream and things like that, I stopped liking the commercial ice cream. So for at least the last, I want to say 5 years, have been making my own ice cream.
Wow.
So I make ice cream at home and then I enjoy that. And, but my favorite desserts, it would be like anything that I can make and share with people because I love doing that. So if I have a vegan friend for whom I can make a vegan dessert where the people who are not vegan do not lose any of the taste, like that's what I like doing, like cater to people who would love to enjoy desserts or eating any other thing.
Well, and that's amazing. And I'm going to answer the question in just a second, but I want to go back to that a little bit because in the notes you had mentioned that that's one of your passions, food, and you see some parallels with healthcare. Tell us a little bit more about that.
So as I connected more with food, healthy eating, organic and clean practices to have better access to food, I saw the parallels like really closely because good food means good health at the foundation, better immunity, stronger communities, and all of these things. There's the only barrier that I see is like the equitable access. Not everyone has access to good food. There are many places in the United States which are still considered food deserts. So that, and then coming to healthcare, it's the same thing. Like good primary healthcare ensures better health at the foundation level, right from the cradle, beginning right at birth, actually before birth, with good primary healthcare to the moms. And then if someone keeps getting that equitable access to quality primary healthcare, they have a smooth ride ahead, despite what twists and turns life may throw at them. And that is what helps me like draw the parallel between food and healthcare, because both need equitable access. And if both are available to a community, it makes their life expectancy actually go up. And they don't just survive, but they thrive.
Well said. And that's just beautiful. I'm going to use the word twice today. It's stupendous. So if you missed it the first time, we got it in there again. And now that we've talked about eating healthy, I'll tell you what desserts I like.
Right.
I do like baklava. I'm always probably a sucker for pecan pie, and I also like key lime pie. And so, yeah, those, if I picked three, but I guess I could do what I want because ultimately it's my show. So we're getting close to that half an hour time frame, and we've covered some amazing things. I love what Primary Care for All Americans is about. I love the direction that it's going. I love the ripples of change that are possible related to this. So before we finish, I think it would be fantastic to hear from both of you, maybe impart one more thought, one more idea, one more notion, no specific guidelines to this, but to double click or add on to that, please tell us how everyone can get a hold of you, websites that you think are important, so on and so forth. So Fatima, why don't we start with you, if you'd like to impart one more thought, and then we'll go to you, Michael.
One more thought for me would be like, every drop adds to the ocean, although it looks like it's a huge task going forward, but we just have to keep adding to it drop by drop and go ahead one step at a time, because it's important, and anything that's important is worth doing, no matter how difficult or challenging it gets. And for the where can you find me? I love food, sharing food, and that is sort of my way of carrying on with my grandparents' legacy. They were great foodies. You can find me at dynamic.Fatima Khan. It's my food blog on Instagram.
Very good. And that information will definitely be in the show notes for the listener. And Michael, how about you?
Well, the most important part of building a movement is when every single person joins it. So to everybody who's listening, we need you. We need you to join us. And you can join us at www.primarycareforallamericans.org, all one word. Click Join Us. Please give us your email address and your zip code. That's really all we need. And then you'll be part of this movement that's building a healthcare system for people, not for profit in the United States. But it won't happen unless you sort of start clicking. It won't happen if you sit back and watch it. It happens only when everybody, sort of takes one small step forward together, and then we have the numbers that we need to really begin to make the change that needs to happen. We may try to involve you in one of these local work groups, but you don't have to come. All we need you to do is be present, be paying attention, to join us on Zooms. We do a Zoom every 2 weeks to sort of bring the community together. You don't have to do any of it, but everything you do matters. So we really need you more than anything else. And then I guess I personally available at www.michaelfinemd.com, where there are a bunch of books, and I also send out every month a pretty interesting little column that I write for a local news organization. The column's called What's Crazy About Healthcare. And I think that's been helping people who are not trying to live through this mess understand exactly what works and how dysfunctional it really is.
That's good stuff. Well, and this podcast was a result of me coming to one of the meetings a few weeks back. We were having a conversation about getting the word out and doing some additional things. And I was like, well, I've got an avenue that, doesn't reach millions of people at this point, but, maybe one day that'd be kind of cool. But it definitely reaches hundreds of people. And imagine if every one of those person joins Primary Care for All Americans, right? And then these continued positive ripple effects, if you will, and then next thing you know, we got family physicians all over the place, which would be ideal. Michael, it looks like you wanted to click in there.
Yeah, just to pick up on your ripple notion, if every one of your podcast listeners clicks and joins, and then gets one other person to join, and that one other person gets one more person to join, that's exactly how ripples build a movement. So Todd, you are a movement builder of first rank. You're making this movement happen. And if everybody does some little part of what you're doing, we will make the movement, spread it across the country, and make this thing a healthcare system that's for people, not for profit. And, sort of changes, the other thing that's happened in the United States is I think, the fact that healthcare is so much about money has created a kind of collective moral injury where our hearts have been broken by this notion that we only do things for profit, not for each other. So that probably ties back to Fatima's cooking, that the central piece is doing things for each other. That's what makes us who we are. That's health, as I think most of us would define it. And that's the opportunity for us to recreate so that we have a healthcare system of people taking care of each other instead of a money-making process where people just cannibalize each other.
This was, what the heck, I'll say it 3 times, stupendous. And as
thanks
always,
for doing it.
This is beautiful. And as always, we will end with, what positive ripple of change will you create today?
Grab your copy today. Ripple of Change is available in hard, soft, and ebook formats. More information at www.ourquadrupleaim.com. Thanks for listening, and let's turn ripples into waves of lasting change. Stay tuned to this podcast as we search for examples of our quadruple aim.